My name is Terrell Thomas. My pronouns are she and her, and I am with Stanford Sierra Youth and Families, and I am pleased to be your moderator for today. And today's session is supporting behavioral workforce recruitment and retention. And we're pleased to have our presenter, Ebony Chambers McClinton.
Good afternoon, everyone. I'm really grateful to be here with you all and spend this next hour together. I recognize that, just in the light of the conversation around workforce and retention, recruitment, we're all so busy that it takes quite a bit for us to be in spaces where we hold time to learn and connect with one another. And so I appreciate that with the many different priorities that I imagine that you all navigate daily, that you chose this time to commit to having this discussion. I'll be my role in at Stanford Sierra Youth and Families. I'm Chief Equity and Partnership Officer, and also do a lot of community work in just elevating not just diversity, equity, and inclusion, but the role of lived experience in our communities and the important part and value that they have and add into the many different systems that we all work in and are a part of. And so I'll share a little bit about that as well. These are our learning objectives for our time today. And so one of the things that Stanford Sierra Youth and Families partnered with CARE to do was hold listening sessions across the state of California with a number of counties to hear from community-based organizations, providers, as well as a large number of county staff around listening to the strengths and the challenges related to our current workforce landscape. And we know that there are quite a few challenges and needs that are important for us to examine, understand better, and then figure out how do we work within those challenges and come up with some successful strategies. I'll hold some time to talk a bit about some of the partnerships that we created with human resources in regards to recruitment and as well as retention, the employee wellness strategies that we implemented, as well as the consideration for increasing peer roles in supporting our clinician shortage and our shortages in some of the other workforce areas, as well as understanding the culture that we've created around DEI practices that support retention and recruitment, and wellness strategies, peer roles, DEI, a partnership with HR are all some of the things that we put into place to really support workforce recruitment and retention. All right, with that, I'm going to move right in to a little bit about our organization. This is our mission, our vision, and our values. Stanford Sierra Youth and Families serves about 6,000 youth and families in the greater Northern California area, spanning over about 7 counties, and provide services towards mental health and behavioral health services, support to youth impacted by child welfare system, as well as the juvenile justice system. And so you may hear some of that come up as we share some of our strategies and how we work within those different systems. So this is just the review, and it's a little bit of an overarching kind of high-level review of the listening session data that we were able to capture. And we captured this data, this is just recent, starting in late November through early January, where we held one-on-one sessions. Folks were able to schedule time, and we were able to hear directly from county MHSA coordinators, behavioral health county staff, HR, and a number of different roles around some of what they were experiencing related to this. So we'll cover some of it. And as you're listening, feel free to share if any of this resonates, like, oh, yes, this is something we're also navigating, or if there's something that's not mentioned, feel free to drop that in the chat as well. So what you see here is that those interviews were conducted. These were the counties that were involved: Sacramento, San Diego, Santa Barbara, Los Angeles, and Santa Clara. And some of the challenges there that were expressed was, of course, what we've all seen is a critical workforce shortage, high amounts in reporting of staff burnout, resulting oftentimes in staff not only reporting the burnout, but either needing to take extended leaves of absence or leaving the field altogether. So even just like I actually can't stay in this field, I'm deciding to do something completely different based on the workforce culture and climate. We also, folks were sharing that there's this high desire to telework. So, not necessarily provide direct services. And what we saw, especially in behavioral health, is because there are now a lot of online platforms like BetterHelp and areas that allow for folks to provide clinical services without actually being in person, that reduced opportunities for positions that required in-person and direct care work, because that's not always an option depending on the types of roles. Also, there seemed to be a report of an uptick in just a lack of interest in the field altogether, and so that was something of note. And then, in regards to the county, a lot of county staff were sharing, our application process is really difficult. The system's difficult. It's really hard to get in. One of the folks that we interviewed shared, I've been working in this system for a long time, and I supported my a family member to get through the county application process, and I was struggling with supporting them. And then once they got in the system, it was really hard to direct them to the right person and get on the list. And so all of those then ended up becoming barriers to that. And I see Lanye shared in the chat, yes, the application process being very difficult. Betty's also sharing the lack of staffing resulting in have to cover multiple positions. Yes, that also increases the burnout because they're coming in, they've got limited training, and then they're getting thrown in there to cover a lot of different work. So yes, agreed. This all really resonates, and I'm seeing the folks who's got their camera on nod their head. We knew the challenges were real, and folks had the opportunity to share that. But we also were asking those that attended the listening sessions to also share what was working or what had they tried that seemed successful. And some were honest, right, and shared, yes, we've done some targeted recruitment, but it hasn't been consistent. Or we tried this wellness initiative for a month, but we didn't continue it, right? But it showed that it proved that it was helpful during that moment in time. But folks still felt kind of drawn in many different directions. But these were some of the areas that were really highlighted, making sure that there was some targeted recruitment effort. So the diversity of workforce was something that was highlighted as important, that those that were being served had a reflection of reflected the community that they were working in. And so a part of strategies was making sure that there was some targeted recruitment efforts. And I'll share a little bit about some of the targeted recruitment we've done within our organization and some successes that I've also seen in community that I've worked with. Mentoring was really high as a strategy. When a part of our listening session was also, if you could choose one thing that would help you to stay at the organization, what would it be? And a large number of folks shared, like, yeah, to be cared for, to be valued and mentored, that someone was walking alongside me and paid attention to and valued who I was and provided me with the resources. And yes, money is important. And also knowing that that someone's walking alongside me and invested in my professional development is priceless, because I'm getting connected, they're mentoring me, they're also linking me to professional associations and these other areas. And so that was something that was also really important. And I see Lanye saying, yes, that is mentoring is important. Wellness initiatives was also high on the list, and we'll share some of the wellness opportunities that we've put together to support our teams. And so just having something that was consistent, that allowed staff to focus on their well-being, and really look at not just individual self-care, like, hey, hope you're taking care of yourself. Oh, this was a rough day. Don't forget to self-care. More than that, something that was really intentional, that held space for them in the workspace, but also found a balance of increasing workload while not then also saying, don't forget to take care of yourself, and then overwhelming and overburdening them with work. And that goes into this next area of flexibility and opportunities for work-life balance. Really making sure that while, some of the work may have required folks to be in person, there was still maybe flexibility with their schedules, and how they scheduled things really mattered as well. Of course, we would be remiss to not say that, right, that there needs to be better pay, incentives, competitive pay is important. We can say all these things, and also we need to be able to make a living and pay our bills. And so that is one of those other areas that was high. It was the workforce shortage, and creating a pipeline, getting excitement. As I shared on the previous slide here, that lack of interest in the field was something that was high. And so we know that we have to have a career pipeline. We have to start getting young people excited as young as high school or junior high, and making sure they're aware of these are some of the ways that you can support your community if you have this interest. But starting that at an earlier age than even college or their final years in their college career. And then reevaluating positions. Is this position still needed? Can we consider different roles? And this is where I bring in a little bit and touch on peer supports as well, in regards to supporting the workforce as an added resource, but also reallocating initiatives. Is this something that's so important right now, or can it wait based on our current climate? What is our sense of urgency on all of the things that are on our plate, and how do we make sure that we're reallocating our time so that it's really meaningful and impactful to our workforce and serving them in the best way? These were a few quotes, direct quotes from our listening sessions. It speaks to that application process being difficult and confusing. This speaks to what was in the chat. That's Betty shared that. Lack of staffing results in covering more, and then it's the burnout. And this is almost right, almost verbatim, Betty, right? Losing staff results in losing more staff as responsibilities increases, increased burnout. So very much so resonates here. And then these were some of the areas where, these are some of the quotes related to strategies. Hey, I want to learn from my employees. I want to hear from what they're sharing they need. And I want to learn strategies that are innovative from peers and partners. And so that's a part of hopefully what we'll have an opportunity to also have some time to do today, is also hear from our peers and partners, that having a space to think about these things and be innovative, and hopefully, take notes and think of things we can bring back, helps us to show up better in our workspaces and for our colleagues. Implementing hybrid and telecommuting schedules. I know for myself, one of the things that has allowed me to really maintain my sanity in the pandemic is having the ability to work from home and have some of that flexibility has really helped me in my day-to-day, and what my personal needs are and my workforce needs are. And then also when there are needs and the need to be in the office or be in the community, there's a lot of flexibility there. And so having really assessing what are the needs, what needs to be in person, what doesn't, and how much restrictions are we placing on employees or structures, and can we really assess what the needs of our community are, the needs of our staff and our colleagues, and then create a plan from there. So whatever hybrid environments and flexibility we can offer, that would be high as a priority. And then creating more promotional opportunities so that staff have the opportunity to promote through the system. This was directly from a county behavioral health staff as well. I'll share just a bit about some of the partnerships we leveraged in regards to hiring and recruitment, and just quickly want to share we've been paying close attention to the workforce shortage, but one of the areas that really kind of started helping us to examine a bit more some of the needs of our community is that we joined Sacramento County's Behavioral Health Race Equity Collaborative. That's what BREC stands for. Not that you need another acronym to the alphabet soup. You probably won't ever have to hear it again, but it is stand for Behavioral Health Race Equity Collaborative. And with that, we had a goal to increase more representation and do a better job at serving our African American community, because there were some behavioral health disparities, and not just behavioral health, but also we see in child welfare and an overrepresentation in our juvenile and our carceral juvenile justice systems. And so with that, our African American community really became our priority focus group, and that became also a priority for our hiring, as well as a focus on our recruitment efforts. One of the great things about taking a look at one group is almost, where you can start kind of doing a little bit of what we would call targeted universalism, is kind of examine one and then figure out how can we replicate this so that all communities and we start reducing and closing the gaps on some of those disparities. One of the areas in partnership with HR that we knew we needed to do was examine our current hiring practices and consider lived experience as equal to education. We knew there are some positions we couldn't do that for. We can't say, oh, you've got 4 years of helping people. Well, that sounds like we can, get your license as an MFT. We know that that's not realistic. But there were some positions we had in finance, in admin, in some of the specialist roles or paraprofessional roles that had requirements for bachelor undergraduate degrees that we had decided was what was necessary, when if coupled with lived experience and work experience, professional experience, that they would still qualify and do excellent in their roles. And so we did an examination of that. And changed a lot of the requirements for some of the jobs coming in to hopefully open that up, because we know that there are gaps in our educational systems as well. And we wanted to make sure that those that had those skills and abilities could enter the workforce and have more opportunity to increase our recruitment efforts. We also, in addition to that lived experience, took a look at our pay equity as well. And that's another area around retention, but also recruitment, is our peer advocates that were coming on board. We wanted to make sure that if we really strongly valued peer voice, that they were also compensated at a bachelor's degree level, because of the number of years of lived experience of navigating systems and the ability to support our families in this very unique way. And so our lived experience staff come in at the same pay level as our bachelor's degree staff as well. And that was something that also shifted and also helps with our recruitment of our family and youth partnership team. We also wanted to do some very intentional outreach to our African American, Black, African diaspora community. Those are those acronyms there that you see in the middle, regarding job openings and our application and career pathways. And so that meant that we partnerships with our HBCUs, that's the historically Black universities, partnership with our local Black Chamber of Commerce. Again, as I shared, this was the start of one group, but then expand. So now we've partnered with our Rainbow Chamber of Commerce, our Hispanic Chamber of Commerce. This obviously continues to grow, to continue to find pipelines and raise awareness, as well as our not just our HBCUs, but our local universities, Black Student Unions, Association for Black Social Workers, lots of different intersections of, but also local groups. So we have something called the SAC Cultural Hub, which is a local Black community group that shares out resources and events. And so we wanted to make sure that we had connections with those groups as well to be able to share the work that we do. I think another area around recruitment is also highlighting one of the areas we're finding is that our communities and the our potential applicants that are coming into the workforce and just graduating, if we're catching them as they're just graduating and finishing school, is there is an increased and deepened commitment, especially over the past few years, to being a part of social justice and seeing an agency's commitment to diversity, equity, and inclusion. And so a part of that also meant our commitment needed to be better represented. And so we moved some of the things. We had deep commitments. We've been working on embracing and doing a better job of creating more inclusive environments in the workspace. But we worked to put our DEI statement on the forefront of our website. We worked to have our statement reviewed in the application process, as well as our what people were consuming through our social medias, and making sure we were raising awareness so that they knew that they were coming to a place where we were examining racial disparities. We were fighting to dismantle white supremacy culture within our workforce. And we wanted to create an environment where if you were a part of the LGBTQ community, you knew that you would be embraced, welcomed, and supported in your role. That speaks to this next one. One of the things that we heard in our listening sessions, not with the county, but when we did with community through BREC, was our Black transgender community were saying, we're not seen in this field at all, and we want to be, but we don't know the organizations that are safe. And so we wanted to create safe pathways for there as well as increase the inclusion of Black men in behavioral health roles. Those were all areas that were really important. And so some of the ways we continue to do that work, and again, connecting this back to, what does this mean for recruitment and retention, is our organization really has to have a strong culture to retain. It has to have a healthy culture to retain, and that starts with leadership. And so we did and do continue. As a matter of fact, on this coming Monday is our monthly 90-minute targeted executive leadership discussions, where we explore the impact of white supremacy in our practices, decision making. We have trainings, and those trainings are then brought back to our staff as well. So it's not just held in a container within executive leadership, but really starts there so that we have comfort in dialogue, and then moves into our other programs and departments. We also knew that we needed to weave equity issues, racial equity issues into our work, not just as a separate conversation, but also in our outcomes, our activities and measurements. And so every program and department has a racial equity outcome. And so that was important for us as well. We established cultural brokers and affinity groups, and I'll talk about those in just a bit because I'm looking at the time and recognizing I should probably speed it up. And then we also utilized our shared leadership group. This is a group of parents in our community, and RISO, which is our youth in our community, who meet with us once a month and review our policies, our practices, engage in partnership. They receive training, they receive support, and they are paid. I think that's important to say. They receive a stipend for their participation in both of those groups to really be partners with us. We can't do this work without the youth and families that we serve. And so it's really important for us to co-create, co-produce this work along with them. So nothing about us without us. I say that a lot as a peer. That goes right in alignment with making sure that any decisions we're making, we're doing in partnership with our shared leadership group and our RISO, our Resilient Youth Speak Out. And then we have a career pathways coordinator that partners with HR. They're the ones who's on college campuses. They're the ones who are working with interns and bringing them in to increase our workforce, and looks at the targeted outreach efforts to diverse communities. We hired an associate director of diversity, equity, and inclusion. Excited that she is on board with us now, and helps to track our plans and activities related to DEI activities. This last one is something that I think has been really important for us to really show the work that we're doing, and that's our quarterly health equity reports, which looks at our disparities across hiring. So we know where are the gaps where are we missing reflections of who we're serving in each program, including our board, as well as tracks behavioral health diagnosis across racial demographics so that we can see if maybe our Black and Brown youth are getting higher diagnosis for conduct disorder, and what kind of training do clinicians need to ensure that they are there's no implicit bias or even explicit bias in some of the treatment that's happening within our organization. And all of our staff have access to this. It's something that's shared. We're discussing it. We're looking at where those gaps are, and this helps our staff. Again, when we're talking about retention, I think this really helps our staff see our strong commitment. And one of the things that we really realized that we were challenged with in regards to this is that we found ourselves needing to do for all instead of doing for one. And so we had to really draw back and oh, hey, Leslie, welcome. We had to really draw back and make sure that we were doing our targeted efforts first and then expanding our practices, and make sure that we were continuing to keep the eye first on our priority community and then replicate that into other communities. I didn't mention the interviews, but we absolutely did update like our interview questions as well to make sure we were better reflective. And this just talks about how much representation matters, that a part of a retention in a workforce. And one of the things we've heard from leaders of color I'm a part of a leaders of color group across the state of California, is I feel more well accepted, and I'm able to stay in my organization when I see others who look like me, others that I can connect with, and our families feel more supported when there's a reflection as well, and there's a partnership. So I'm going to step right into some of these wellness strategies, and Terrell is going to drop a couple of resources in the chat that we utilize. Wellness is something that we take seriously. I mentioned as the Chief Equity and Partnership Officer at the organization, I provide support to our peer workforce, which consists of about 40 staff. There is a dual role here, in they're providing direct services to those in our community, but they're also sharing some of the deepest, most vulnerable parts of themselves. And so I really felt that having strong wellness strategies in place was extremely important for our team. I think it's important for all teams. So this is something that we have implemented, but we are looking at moving this across as a full organizational practice. One of the, thank you, Terrell's already put the supportive consultation tool, the wellness bingo, as well as the wellness plans in the chat. And so we have supportive consultations where our staff, all of our staff across the entire organization have and can develop professional development goals. Those professional development goals can be anything. It doesn't have to be related to the work they do. It just says, we care about you. One of our managers is working on being a writer. And so their professional development goal is around how often they're taking time to write on the weekends and on the evenings or early in the mornings. And so this just kind of, really highlights that, we want to see our staff thrive, and we care about them and their growth, regardless of whether they're growing in our organization or out of our organization, because either way, it's a win when our communities are stronger. And so the professional development goals and the supportive consultation tool helps ask questions that can help us get there. We have position-specific connections. So if you're a youth advocate, or you're a clinician, or you're a facilitator, or you're a skills trainer, those folks have the opportunity to come together almost as an affinity group and talk about some of the things that are working for them, share interventions and strategies, and that has been supportive for them. I'm really proud of our recovery and recharge, and that is our sobriety group. It's held every Monday, and really our goal of that is to normalize that no matter who you are, everyone is in different stages of their wellness. But we really wanted to make sure that within our workspace and during paid time, folks had a half an hour where they could show up and have a focus on their sobriety at the beginning of the week for a half an hour, if that was their choice. And so that was that is an ongoing thing. We have a walking group where folks just hop on the Zoom and walk and talk together. And then we have a wellness group that meets every 3 weeks. And that is required for our team, that they attend that and just hold space for vicarious trauma, community trauma. And it's just a safe space for them to connect and also debrief. It's always on a Friday so that they can just let it out, let it go, and then hopefully go into their weekend. And then a lot of program collaboration. And I see Lanye's comment in the chat. Thank you for that. The supportive consultations offer that space. I shared a little bit about this, so I'll move through here, but also lots of coaching needs. And we really make sure these are held every week. So every staff has a consultation for 1 hour every week. Sometimes it's less, depending on the needs of the staff. If we've got a more tenured staff, their consults may get moved to every other week, but typically they're every week for an hour that allows for that time and space. The wellness bingo card, shout out to Terrell, who's the moderator. This is something her team put together, but just finding fun ways to engage our teams in making wellness a bit fun. The wellness plan is also another one, not required by our staff, but highly encouraged. And our staff pick their wellness buddies, and it creates a level of accountability. And we hold time during our staff meetings to say, all right, time for you to check in with your wellness buddy and see how your teammates are doing, and they share in their wellness plans areas that when they know they're reaching burnout, so that their wellness buddy can recognize that and remind them about their strategies and hold space for them. And this is just a little bit about the wellness groups, that it's a less formal setting. There's group agreements, but it's not prescriptive, because we really wanted it to just be a space where folks can come and process regardless of what that need was. And I think this kind of just speaks to, reinforcing that positive culture, that positive relationships are there, that our teams feel celebrated. There's purpose and intention behind the wellness. It's not a one and done. It's something that's put on the calendar. It's very intentional, and staff recognize it right away when they're onboarding the importance of that. So cultural blindness, the consultation record is something that is held. It's documented for their time together. It documents where they're at, how they're doing. And so it is an employee record. It's actually, what you have as a paper document, but ours is actually electronically in UKG, which is our system that holds our electronic consultation records. So it is recorded, if that makes sense. Cultural blindness means someone who is missing or not seeing someone's race, maybe their sexual orientation, any parts of their identity that might be missed. So as a supervisor is talking with a staff around through a case consult, they're asking them, how does this family's culture intersect with their needs, and what are their strengths? What are their family's cultural strengths? And so if the supervisor is recognizing that maybe they're not looking at that, there's an opportunity there for more discussion. And the same for that, the same is in line with cultural movement and making sure that we're moving towards recognizing one's needs as it relates to their identities. And I think this goes to seeing our colleagues, our teams as whole persons. And that's, I think, what you're speaking to is, that we wear many hats. We show up every day to work, but we wear many hats. And that speaks to, I think, maybe potentially our next section around the peer role as well as DEI. But just, that even when there are instances that were happening in the community, and I'll talk about this in the DEI section as well, but that, when we had locally here in Sacramento a few years back, we had the killing of Stephon Clark. And with that, a lot of us were coming to work the next day, and it was just like business as usual. And there wasn't like, I didn't feel seen. I know I didn't. As a Black woman, I was showing up and I was like, oh my gosh, this happened and no one's talking about it. And we had to do better. And so now, we've got practices in place where if something happens in the community, when we had the nightclub shooting at the LGBT club last year at the end of the year, the uptick in Asian violence. Just recently, we had another young Black man murdered by the police. We hold safe spaces. We send out an email immediately to address it, and we ask our executive leaders and our directors to bring it to their staff meetings, to talk about it, and to have healing spaces within the workspace so that no one has to show up to work holding something that's happening in their lives, in their communities. But that also helps us show up better as practitioners, as social workers, as therapists, because we can't also not talk about it with those we're serving, right? and so the more we're able to talk about it within our workspaces and create those safe spaces and see everyone for their whole selves and how the many things that impact who they are, allows them to also be able to be better providers in the community as well, because our youth and family already have experienced trauma when they've walked through our doors, and we are ignoring additional trauma when things happen in the community that they also might be impacted by. So we have to make sure that we're opening up that dialogue as much as possible. So Wendy, I'm going to touch on this, the peers that you had brought up at the beginning, the question around onboarding and peer certification. This is just a quick overview of our peer program. We have many roles our peers have: housing navigation. We have a CSEC program that serves youth that are at risk of exploitation. We have parent partners that are county co-located in a number of different offices in Northern California, and child welfare offices, which is a really great program that focuses on permanency, reunification, and strengthens the child welfare and parent family partnerships, as well as we support with family finding and other programs that you see there. And I mentioned this as a part of workforce retention because another opportunity in that, and especially as I mentioned, the clinician shortage is increasing peer roles in behavioral health. One of the things we're seeing and hearing from community is we've done listening sessions, not just with county and providers, but with youth and families. I want to say Terrell probably can tell me the exact number, but over the past 3 or 4 years, we've held, I would say, at least 15 listening sessions with youth and families. And one of the things that really always resonates is we want more peer support. We want to be supported by peers. We want to be supported by someone who's navigated through. And so let's increase that. Let's consider, how do we do that? And one of the ways we know is necessary is making sure that there is support with training and onboarding, that just with any role that's supporting community, there needs to be training and a structure to the onboarding. So all of our staff, Wendy, to answer your question, are going through the peer certification process as it's required for mental health documentation. Even if it's not required, we're having them do it because the training and the additional maybe extra thing you can add to your resume doesn't hurt anyone, and it's fully funded, and they've all been scholarship to do so. So let me know if you have any other questions or if that answered your question related to that. I can talk all day about training, but culture is super important. Training is just one piece of it, but if we do the training and go right back to an unhealthy culture, that's why the monthly leadership meetings where we're having these discussions really matter, because we're creating spaces where leadership then leans more in to having conversations around DEI, and then allows for that to happen within the teams as well. But in addition to that, our staff do all receive 5 hours of of cultural competence training that they all receive, as well as another half day of SOGI training, sexual orientation, gender identity. And then we have a number of ongoing external training opportunities that they are also linked to. And then every quarter we have something called cultural insight activities that also provide additional, almost like a deeper dive into certain topics. Our most recent one was on implicit bias. We've talked about our identities, intersectionality, and intersectional allyship. These are all topics that come up in our cultural insight activities. This keeps the conversation going and doesn't allow for trainings to happen once and then that's it. We never talk about it again. So that keeps that conversation going. Our affinity groups, super excited to talk about affinity groups. This is an opportunity, also known as employee resource groups, an opportunity for our communities to celebrate inclusivity and diversity within the workforce. Our staff who are part of these groups share a benefit. I'm a part of the Black Affinity Group, also known as the Cookout at our organization. All of the affinity groups have the opportunity to rename themselves. What you see here is a list of the many different types of affinity groups that can happen. So anyone in our organization can say, hey, I'd like to start one. We have a train the trainer that we offer them, and then they can hold it monthly or every other month, depends on the nature of the group and how often they want to meet. Our Cookout Affinity group meets once a month on a Friday for about 90 minutes. And the facilitator comes up with just a topic, any topic. It doesn't have to be related to the work they do. It's just a space for connection. We have a Latinx affinity group. We have a Pride affinity group. We have a Native American affinity group. Yeah, so our affinity groups do offer that opportunity for that connection. We also have an Unpacking Privilege group that meets every month as well. And so this just gives folks time to connect. During our Black History Month, just this in February, we had someone come in and do guided meditation and wellness. We were able to just come together in person and connect as well. And every month we find new ways to continue to celebrate. We're coming up in May on API Heritage Month, and we're just excited for the opportunities to keep not just embracing the cultures for those specific months, but all through the year. And the affinity groups allow for that as well. We also employ now cultural brokers. They are not employed as cultural brokers, but they're employed in their role, and then they receive an added stipend and pay increase for being a bridge and relationship builder and support to other staff. One of the things that I thought was really important when we implemented this was that it wasn't just cultural brokers then being identified and getting more added to their work, but it was things that folks were already doing. So an example of that, our LGBT cultural broker was meeting with a lot of teams and supporting them on providing better increased support to our families who had trans youth. There was a lot of rejection happening. There was a need for more support and training, and there was also a need for more support and training for our staff. And so one of the staff started our LGBT support group for our youth and for parents. And then she also would meet with staff and do consultations because she herself had a trans youth and wanted to ensure that clinicians had the right language and the right affirming supports to support our youth and our families. And so she was a natural person to identify as a cultural broker because she was operating as that. And we did that for our Latinx community, our African American community, our API community, and our Native American community. So we have cultural brokers, and they are just naturally providing a bridge, training, supports. They lead our cultural competency committee and lots of other areas. And that allows for their natural abilities to be compensated. And another part of, again, retention is recognizing staff talents, but also creating inclusive environments for our diversity. We also ask questions. Another part of recruitment and retention is also ensuring hearing from our staff and actually doing something with it. So our employee engagement survey does that. We do the employee engagement survey twice a year, and allows for us to really be able to, in the meantime, hear the feedback and then make a plan for action of how we want to improve our practices. These are just some of the positive feedback we heard, but there's constructive feedback we've heard as well. Just a few that to note. That staff were saying we'd like more training to support our neurodiversity, and have neurodiverse affinity groups. And so we're working on training. This is just from our most recent employee engagement survey, but working on trainings that will also meet the needs of the areas where our staff are sharing. This is an additional need for us. We need more support here, but that allows for us to listen to that. And then I mentioned our leadership teams coming together already. That's a part of that feedback as well, that they wanted more than just say myself and a couple of others that were leading DEI, but they wanted to see it across the board and from more than just staff of color. And that was important too. A team effort of leading this and ensuring this is in place.